Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Recently, the world has witnessed India struggle to manage a very severe COVID-19 wave that has resulted in that country's health system getting overwhelmed. Many have therefore asked if Zimbabwe is not going to find itself in a similar situation. Specifically, some have asked if Zimbabwe is prepared for a third wave. My update today is therefore focusing on what government is doing to prevent a third wave. But first, let us quickly go over a few key COVID-19 statistics. This past week, the top 5 countries with the highest burden of COVID-19 in the Africa region were South Africa, Morocco, Tunisia, Ethiopia, and Egypt in that order. By the end of Thursday, the 29th of April 2021, Zimbabwe had a total of about 1,000 plus active COVID-19 cases, most of them mild and isolating at home. Over 92% of all those who contracted COVID-19 disease since the start of this epidemic have recovered. So what exactly is government doing to avert a third wave? Recently, government put in place a detailed and comprehensive March to August 2021 intersectoral response plan, whose main objective is to strengthen the national response, COVID-19 response, with a view of preventing and or managing a potential third wave. The plan is guided by 10 key strategies. These key strategies included the 8 originally recommended by WHO. Actions being carried out or taken to strengthen implementation of some of these 10 key strategies can be summarized as follows. First of all is the vaccine deployment strategy. This one is one of the 2 additional strategies that government has added to the 8 original WHO recommended strategies. This critical strategy is important for ensuring that the health system is not overwhelmed. Remember, COVID-19 vaccines are administered to help protect against severe disease and, of course, against hospitalization. Vaccines, in conjunction with all other preventative measures, help protect the nation from a third wave. Work is therefore in progress to ensure that vaccine rollout is on course. Many vaccination centers have been opened throughout the country. Hotspots as well as border towns are being prioritized. The second additional strategy that government is implementing is genomic sequencing. Strengthening of genomic sequencing of COVID-19 virus is really critical at this stage because early detection of new variants will allow the country to manage variants in a timely fashion and hence, of course, prevent an increase in numbers of severe cases that might require hospitalization. Hence, also prevent overwhelming or stretching the health system. Some equipment for genomic sequencing work is already in country. Reagents have been procured and plans for training healthcare workers are at an advanced stage. Let me now focus on some actions that government is taking to strengthen implementation of some of the other or the original 8 WHO recommended COVID-19 response strategies that are clearly and comprehensively outlined in our March to August 2021 National COVID-19 Intersectoral Response Plan. On disease surveillance strategy, it is important for us to first remind ourselves that the main aim of disease surveillance or a disease surveillance strategy is to detect and manage cases early and hence stop the spread of disease. Disease surveillance has been strengthened in both the general communities as well as in schools by updating standard operating procedures and guidelines, as well as, of course, by training the surveillance teams on the ground. Work in this area has seen an early detection and management of cases in schools, resulting in the prevention of disease being transmitted to communities out there. A strengthened disease surveillance system in schools and, of course, in communities will go a very long way in preventing virus transmission and hence, of course, protect the nation from a third wave. Laboratory testing is a critical strategy for managing COVID-19. Implementation of this strategy is being strengthened through immediate procurement of additional testing consumables using government funds, as well as using part of the $75 million Global Fund COVID-19 response grant that was recently allocated to Zimbabwe. The Global Fund procurement process is being done through an approved fast-track Global Fund application mechanism. These testing consumables will therefore be in country soon and will therefore go a very long way in helping us prevent a third wave. If we move to case management strategy, progress has also been made in ensuring that the rapid case management response teams that we've talked a lot about have been set and put in place. These will ensure that all mild and moderate cases that are being managed at home in the communities are properly followed up in a timely fashion. This approach also ensures that all mild and moderate cases do not end up congesting limited hospital capacity. One of the most important strategies for a robust COVID-19 response is community engagement and risk communication. A lot of work has gone into a strengthening implementation of this strategy. The Get Vaccinated campaign is a good example, for example. Some of the other activities that we're actually planning and putting in place campaigns are also going to help strengthen and implement this particular strategy. Other planned campaigns are being implemented with a focus on supporting communities around schools and ports of entry, especially on the need to adhere to COVID-19 regulations in order to stop the spread of COVID-19 in our communities. For more detail on what the government is doing to strengthen the COVID-19 national response in order to avoid a third wave, check out the comprehensive March to August 2021 Intersectoral National COVID-19 Response Plan. The plan also covers various activities being implemented by the task force subcommittees. You can find this document on the Ministry of Health and Childcare and the Ministry of Information websites. In the meantime, though, let us all plan to get vaccinated. Continue with all the other recommended COVID-19 prevention measures, such as staying away from crowds and big gatherings, washing our hands frequently with soap and running water. And yes, let us also continue to wear our face masks and do so properly. Thank you.